is Dr. Brian Palafox. I am the co-director of the cardiothoracic program at St. Joseph's Hospital. And we are one of the busiest hospitals in cardiothoracic surgery in Orange County. St. Joseph's Hospital now has the dubious distinction of being in the top 12% of hospitals in the nation with respect to survival statistics as documented in evidence-based medicine put out by these studies done by the Society of Thoracic Surgeons. With respect to valve surgery at St. Joseph's Hospital, we do a lot of valve repair and valve replacement surgery, as well as repairing ascending aortic arch and major complex resections of the heart. Some of the questions that have been posed to us are, what type of symptoms do patients have who have heart valve surgery? And basically it all depends on which valve is involved. The major valves that we deal with are probably the aortic and the mitral valve. With respect to the aortic valve and the mitral valve, there are two basic pathologies that you have. One is a stenosis or narrowing, and the other one is regurgitation or an incompetent leaflet where they don't come together. The symptoms vary depending on which pathology you have. Specifically, in aortic stenosis, you get progressively shorter breath with activity, and you may get little palpitations over time. In mitral stenosis, you'd get shorter breath, but your symptoms would probably come on a lot sooner than would happen with someone with aortic stenosis. In regurgitant valves, that is a little more, the heart is a little less tolerant of aortic stenosis. The heart will tend to dilate, and by the time you start becoming more symptomatic, the function of the heart has gone down. But for the most part, the symptoms are shortness of breath with less activity and decreased activity, as well as palpitations and symptoms that would be or could be referred to as we've all seen with coronary artery disease. And most valve problems usually are associated with some sort of coronary problem as well. There are three ways to manage a cardiac or valve problem. One, you can do nothing, but the disease will just progress. Two, you can manage it medically, where they will give you medicines to increase the contractility of the heart or decrease the ability of the heart to work by, as we call it in our vernacular, of afterloading the heart. And then finally, you can replace the valve that is not working well, and that would be surgically.